Welcome everyone to the session Lower Costs Without Lower Care, a strategic approach to non-clinical spending. I'd like to extend a huge thank you to LogicSource for their sponsorship of this discussion. LogicSource is an innovative leader in procurement services and technology, purpose-built to drive profit improvement through better buying. Please welcome our excellent moderators from LogicSource, David Panino, Chief Executive Officer, and Chris Marr, Managing Partner. Chris and David, I'll turn it over to the both of you to kick us off and introduce the panelists we'll be hearing from today.
Thank you very much for the introduction, and we're looking forward to the conversation today. We're excited to have Brian White and Keith Knoll with us today. Brief introduction to each of them. Brian currently serves as the Chief Executive Officer of MIU Care, where he's responsible for their strategic direction and their financial plan and overall long-term growth. MIU Care is a healthcare meets consumer digital platform that connects patients, families, caregivers, providers, and data sources while using behavioral analytics to improve healthcare outcomes. Brian is a longtime executive within the health system space. He has served as president of the Atlantic Group for Bon Secours Mercy Health. He was responsible for about $3.8 billion of revenue, 14 hospitals, joint ventures, post-acute, 100 care sites, hundreds of employees, and thousands of affiliated physicians. Ultimately, more than 22,000 employees across Maryland, Virginia, South Carolina, and Florida. Brian also served in various executive roles at LifeBridge Health in Baltimore, Maryland. Brian serves on a number of different boards, past and present, including American Cancer Society, Power 52, Living Classrooms, Healthcare Council of the Capital Region. He's also received numerous awards throughout his career from organizations like Boy Scouts of America, Chimes, American Heart Association, Maryland Daily Record, etc. Brian graduated from SUNY in New York, and he has a master's in business administration from Regis. So welcome, Brian, and thank you for your time here today. Keith Knoll. Keith Knoll is a client of LogicSource. Keith is Senior Vice President of WellSpan Health. He's also their Chief Administrative Officer. As Chief Administrative Officer, Keith has corporate responsibilities from everything from supply chains, plant, engineering, construction management, public safety and security, dietary nutrition, environmental services, and WellSpan's business optimization efforts. He's worked in a variety of different roles at WellSpan, including president of their flagship hospital for 10 years. Keith also volunteers his time as a trustee of several community boards, including United Way of York County, York College of Pennsylvania, Penn State York, and Pennsylvania Crime Stoppers and FEI Industries. He attended Penn State University. Keith also went on to University of Minnesota's graduate program in hospital and healthcare administration. So Keith, thank you very much for participating today in this discussion.
Thanks, Dave. So as we get into today's session, I think it's important that we set the stage a little bit in terms of how this group came together. And Dave and Brian got to know each other on a personal level, living or actually being next door neighbors at one point. And as was mentioned, LogicSource is a sourcing and procurement professional services company. We specialize in what private industry calls indirect procurement, what would be called in healthcare purchase services or non-clinical spend. And the thought was there's a lot of learning and a lot of leverage and a lot of category expertise that we have as pre-built assets within our firm that may have application to drive greater efficiency and drop more savings to the bottom line, or more importantly, free up funds for investment on the clinical side to improve patient care, accessibility, those types of things. So Brian made an introduction to WellSpan Health. Keith is here as a senior executive of that group. Keith, in the earliest discussions that we had, was intrigued by the fact that in healthcare, and Keith, correct me if I'm wrong, you think of things, you see things through a healthcare specific lens. So you have comparisons in terms of how your performance stacks up with other systems. but you don't necessarily know how you're stacking up in terms of efficiency, in terms of buying power outside of the healthcare realm. So one of the things that we brought as from the outside is that expertise and perspective. And so, Keith, I'd ask you just as a starting point, when we were talking just before the recording, you were talking how you looked at the non-clinical spend, the amount of investment you had in terms of just a few people managing what is a significant expenditure from a WellSpan standpoint.
Yeah. Yeah, it was interesting. So we have a pretty dynamic CEO, Roxana Gapster, who joined us almost 3 years ago. And when she came on board, she sent me an article from Harvard Business Review. And you got to remember, this is prior to the pandemic. And it was the top 100 supply chains in the world. And she dropped me a note, not one healthcare organization on this list. And so I sent it to the supply chain team and I said, should we be the first? To kind of put it out there as a challenge. But the point was that if we're going to be an outstanding healthcare supply chain, we have to learn outside of healthcare to do that. We can't just continue to compare ourselves to internal industry groups. And there's some really good internal industry healthcare supply chains, but the greatest you'll know are probably outside of it. And so when the LogicSource opportunity was brought to us, it intrigued us because it was maybe we can learn something in a space that isn't necessarily the focus of healthcare supply chain from folks that are outside of it. And that's really how our conversation with LogicSource started.
It's interesting, Keith, because when Brian and I first chatted about this, I was just talking to Brian about what I do for a living in a casual conversation. He said, boy, why don't you do that for health systems? And I had no idea, and said, look, what I find in the enterprise market, our clients are clients like Lululemon and Gap Inc. and Western Union and Titleist, Ocean Spray, et cetera. It's about 20% of revenue is purchase services. And I said, gee, Brian, I wonder if that would hold in hospital systems. And, Brian, you made a couple phone calls for us, and it was really fascinating what we found.
Yeah, it's really interesting, too, because when you think about our industry, pre-COVID, we operate in very small margins. We don't have access to incredible financial resources. We operate as an industry at a median of 2 to 3% operating margin. So we need to find ways in which we can generate financial resources so we can continue to do things that are most important to us. So to Keith's point, finding non-traditional, finding next generation resources is nothing but advantageous so we can continue to provide care for patients, which is why we existed.
Yeah, I think supply chain, the pandemic took a healthcare supply chain and really elevated it. Brian, being a former CEO in the healthcare provider space, knows that most of our attention is always paid to the patient, the supplies that are provided to the patient, and supply chain is was an afterthought. The pandemic changed that. Supply chain came to the forefront as being a major concern, and then also surfaced as an opportunity. And so there's a lot of focus and attention now on healthcare supply chain, which previously probably was flying under the radar.
Yeah. And Keith, you were surprised in prior conversations at the percentage of your spend that was purchase services.
Yeah. So when we did the internal analysis, about 15% of our total expenses is on supply chain, but over half of that was on purchase service spend. And so it's, or indirect spend, probably a little bit more correctly identified, with a large portion of that being on the purchase service side, the outsourcing side. And most of that also falls outside of your supply chain. So many of those contracts and purchasing arrangements are being handled by department managers, not part of the supply chain process, but outside of that area. So there's not a lot of organizational transparency into it or focus into it. And I think what we're trying to do is to create a little bit more rigor in that space. And then also looking at the spend more routinely. Supply chain in purchase services used to do RFPs, and then they would kind of complete that project and turn it over. but would never continually review the spend on those agreements once they've been turned over to the end user. We're hoping to get a little bit more deliberate in our approach in monitoring that expense within the health system.
And one of the things, Keith, I know in the discussions that we had, and we did an in-depth analysis working with Keith's team at WellSpan to understand what's being spent, where it's being spent, the structure of that. And we dig into not just the rates you're paying, but also do you have contracts in place? Are the contracts well structured? And when we say well structured, we're not looking at that from a legal perspective, but from a commercial perspective. Are there the right terms and conditions built in to enable WellSpan to have the best commercial relationship with whoever the vendor is? And we found, as we dug into it, one of the things was that we found exactly what we find in the non-healthcare space. So the spend may fall a little bit differently, proportionately into different buckets. If you think about it in terms of corporate services and IT and facilities being the three largest that we saw at WellSpan. Once we dug into the spend, it was exactly as Keith said. You have functional leaders who are doing the best they can, to buy. Everybody tries to do the best they can, but they don't necessarily have the category expertise, the resources, the benchmarks, and so forth on a day in and day out basis to deliver. Can you talk a little bit, Keith, about kind of the early days? We've been working now with WellSpan for a few months. It's early days in the relationship. Anything that's kind of either reinforced the decision, hopefully that you made the right decision, or anything you learned from that?
Yeah, well, I think the first thing was we approached it a little skeptically out of the gate, right? Because as healthcare leaders, we're particularly in supply chain, we like to have control over what we're doing. And so kind of getting, particularly the supply chain team comfortable with the potential of outsourcing a large portion of our spend to an outside company, particularly one that's not in healthcare, was a little unusual. And so there was a lot of tire kicking. And, as you know, Dave and Chris, we had a lot of meetings to try to figure this all out. We had to do a lot of reference checks and make sure that what you were reporting was actually going to work within our healthcare system. And so that was probably the biggest change in viewpoint, was trying to get people comfortable with this, because we're not very good at outsourcing in supply chain. We tend to like to do everything internally. Once we got folks comfortable, then everybody started to get excited as the process went on. And it was interesting when we were going through the contracting is probably when people really started to understand what we were trying to accomplish here. And then you saw a pull coming. The supply chain team was pulling, our finance team was pulling. And I think now, Chris and Dave, what you're probably seeing is that some of the end user groups are pulling. I think the pandemic and some of the staffing issues that have been created have shown that getting some additional support in RFPs and the contracting and the price sourcing and procurement side of things is actually going to help some of these areas where before it might have been a little bit more challenging. So I'm seeing a pull now rather than a push, and it's exciting from our standpoint.
That's great.
Following up on that, I mean, Brian, you've been involved in a few of these with us, and WellSpan, has been the sort of early adopter, with executive leadership from Keith and the team, taking a shot on this, and so far, results have been, great. There's others out there that have said, boy, I know I need to do it. I just don't have time because I'm so low on resources. I'm, out in the hallway on my cell phone trying to order emergency, materials. And how do I justify the time to work with you all? As Keith just mentioned, there's a lot of meetings to bring everybody along. And with how hard hit health systems are today, what, as an executive within the space, running these systems, what would you say to those CFOs and those chief administrative officers on how to prioritize these things?
Look, the crisis and the pressure on our teams is overwhelming, but the reality is that these are actions and directions we have to pursue because these issues aren't going to go away, number one. Number two, as I mentioned earlier, it's not like we exist in high margin locations, that we can find supplemental funding to keep funding our staff, funding our resources, funding our facilities. We need to do those types of things. But I want to bridge back to a conversation that you and I had, Dave, very early, and I think it relates to what Keith was alluding to. I remember when we first started talking, and again, it was with no agenda. We were neighbors. We were talking. I was talking about my background. You were talking about yours. And I was talking about, as we started to talk about LogicSource and the savings you generate for your current clients. And you said, how much do you guys spend in what we do? And obviously my first answer went to, well, labor costs this and medical and surgical supplies cost this. And you said, what about X, Y, and Z? And I said, oh, they're very departmentally oriented. So we may spend a little bit. And that was interesting to me, Dave, because that triggered more conversations with people like Keith and people like Laura Ellis and people like you mentioned, that all of a sudden, as we start to aggregate it together, we're thinking, holy mackerel, that's a lot of money that you can use the same concepts that health systems do with traditional GPOs into what we're talking about. So I found that overwhelmingly interesting and also necessary that we start looking at ways that we can bring resources to the table so we can fund the things that are critical. There is no negotiation with people like any of us about our teams, about our clinicians, about our ability to provide care, about whatever people need. We have to be able to provide that. And that's not free. That's not free. Add in the complexity of labor crisis, of wage crisis, of fill in the blanks. All these things, they are not happening at zero cost, at zero effect. They're happening with financial impact or financial incredible impact on our resources. So yeah, everybody is incredibly overwhelmed, but the reality that we have to recognize is that we can continue to go down that path, or we can intervene and start to redirect it and change it. And that's what this conversation was about, was to me, is that we can intervene, we can provide expertise and resources like LogicSource into the team so they can go focus on the things that we need focus on, and you bring the resources and the expertise to the team that we don't have, quite frankly. Yeah. I found it's so exciting, which is why I started making calls for you, quite frankly, because I saw the value it has to our industry, and obviously as a executive of healthcare, I wanted to help the industry. So I'm thrilled about the conversation and about what you're doing.
Dave, I'd have to. The other thing is there's never a perfect time for any of this, and I don't know how it is in industry, but in healthcare, it's just the next thing. So now, we're in a pandemic. We're kind of moving our way through it, and then there's going to be all the back work that has to get done. So there's never going to be a perfect time to do it. The thing that I think is really important about this work is that it's going to provide value financially to the organization in an area that has no impact on the care model. It is actually something that is on the indirect spend on services that don't affect the bedside. Most of the stuff we do in supply chain requires clinical care integration. It requires physician time. It requires nursing time. This does not. And if you can provide additional bottom line numbers to the organization without having to impact the care model at the bedside, that to me is free money. And why wouldn't you take advantage of it? It's probably some of the best ROI you're going to have in an organization.
Absolutely.
Yeah, it's interesting.
Well
in that YZ we're talking about for everybody's, it was stunning to us how much the health system spends on marketing, IT, facilities maintenance and repair, which can be everything from snow removal to waste management to, floor care, you name it, the corporate services like legal and consulting. And so there's these massive categories within the health system that don't fall into the direct side, don't fall into the GPO world. And even where we saw the GPOs, I think it's fair to say in this stuff, this indirect stuff, they didn't have the power band they had in the supply side of things. So there was a big amount of opportunity there. And what was really rewarding for us is, look, let's face it, our core business is helping consumer packaged goods companies and retailers and banks. When we save money, they just, they grow, which is awesome. But when you all save money, you provide better care, you provide more consistent care. And that's really fun for us to be a part
And
of.
again, getting back to the GPO, the whole premise of getting into the traditional concept was to create leverage and scale so we can drive cost savings, so we can drive those types of things. And you being able to do that on the things that people like me haven't thought about is incredibly valuable. And to Keith's point, it allows us to do the things we care most about with financial resources that we haven't thought about in the way we're thinking about today. Now, we've all been responsible for that spending, so don't misunderstand my point. And to Keith's point, there's no perfect timing on any of this, because if we're not in one challenge, we're in another one. But we need to think as an industry about partnering with people who can bring that scale, that leverage, like we thought about with traditional GPOs, into everything we do, so we can invest in tomorrow and invest in the things that we care most about. And you said it well, Dave, caring for people, caring for patients.
And one of the things that comes out to me in the discussions that we had with Keith and his team is that the way healthcare systems view spend is different than private industry in another way, in the notion of the need to spend. That lowest cost national provider is not always the right answer. There are local market implications that also have to be taken into consideration. And so as we work with WellSpan, we're building, to the earlier discussion, we're building process and governance and centralized expertise, but we're also doing that in a way that fits the system and the environment we work in, where not only are you a really important provider within the local community, you're often the largest employer, and you're often, what you do has direct impact in terms of the financial well-being of the marketplace.
Yeah, it's very true. So, the GPOs perform a really important function for us. As a healthcare supply chain, there is no way, we have nearly 60 to 65,000 things on our item master. If the expectation was that we would have to create the contract for every single one of them, we wouldn't be able to do it. So the GPOs do a really important portion of our purchasing for us. Chris, to your point, though, there is a portion of our purchasing that is more local. It is more decentralized. And healthcare organizations have found that the healthier the economy of the community around them, the healthier the community is from a physical standpoint. So there is a value to investing locally as well in services. And again, that takes time, it takes effort, it takes comparison. And when you're doing that, you might talk to some local providers. You may not have an understanding of what a national contract would look like. And I think that's one of the things that we're hoping you bring to the table, is to be able to give us a comparison cost, so that when we work with our local vendors, we can actually say, where can we meet in the middle of this to make sure that you're part of our purchasing team, and it's at a fair and reasonable rate for the health system. So I think it's
that's a very valid point, and it's one that obviously I was focused on too, as you would be, Keith. That we're part of a community. We purchase local, we support locally, and that was a conversation that Dave and I had very early on. Is we're not going to abandon that. It's a responsibility we have. His response to me was quite direct. It was not as nice as what you said. It was basically that we're not going to escape that commitment. We're not going to escape that obligation. We're just going to make sure it's tied into market value. We're going to make it tied into, what's responsible to spend. And obviously, the assumption working in the environments that we work in is, of course, it's responsible. Of course, it's balanced. But there's no frame of reference in our world today. LogicSource brings that frame of reference and, quite frankly, that influence to affect it.
Yeah, I think the other part of that is, and it is a recent example that comes to mind in the Dallas market, where we had a client that had a meaningful amount of spend with a local supplier. And they were over market, which, we're trying to drive efficiencies. But two, they were a dangerous percentage of that company's revenue. So if anything ever happened, that company in that community was in trouble. So we partnered with that supplier to provide them substantial spend from 15 or 20 other clients, so that that particular client wouldn't be 50% of their revenue. So we de-risked that supplier for our client. So they were more like 25%, which is still, not where you want to be. You want to get to 5 or 6% at the most. But we de-risked it substantially, and we gave that supplier, who our client thought really highly of, more spend from more companies to make them a healthier supplier. But at the same time, we lowered the cost for our client because they were over market. So we try really hard to we have about 52 billion of spend and growing running through our firm. We try to not only right size your cost base and manage that spend effectively to save you money as our client, but we're also trying to make those suppliers more stable and give them a bigger basket of spend across a larger client base, but at a best of market price, so that they don't have to get hurt in that transaction.
Yeah,
That's
Dave,
incredible. Great.
It's a good point. We found that out coming into the pandemic. So prior to the pandemic, most healthcare supply chain was about single dual source and just in time, delivery method, which sounds really good until you hit a pandemic and you can't find products because you only have a relationship with one or two vendors. And so risk mitigation now is becoming a big portion of supply chain thought process. And how do you make sure that you decrease your risk while maintaining a price structure that is reasonable? And that has to be a balance between national vendors and local vendors, and creating those partnerships beyond just one or two pinch points. So I think that's really a good point.
Yeah. So the question for you guys on executive engagement. So look, I grew up in the IT industry. So to date myself, back in the day, there wasn't a CIO, right? There was an MIS director. They pushed an AV card around. They had screwdrivers in their pocket to fix the machines. They went down to the data center when you went up to your offices. And at some point they put a tie on and they went up to the CEO's office and they talked about innovation and they talked about security and they talked about these things that made them the CIO. And now every health system, every corporation, big or small, technology is a core part of what they do and how they compete and how they run the business. Procurement, just the name alone, is wrong, right? Procurement assumes somebody's made a strategic decision and they're just executing the buy, right? You used a term earlier, Keith, spend management, right? So you also commented on how much you had to do, how many meetings you had to go to bring people along. So how critical is it at the executive level that you stay engaged in these things and really take the time to bring your colleagues along to get the outcome?
Yeah, so I think it's critical, and I think it's critical that it's more than just my position who oversees the support services. So we obviously had the support of our CEO, as I mentioned, Roxana. And then the reason why you all are here is because Brian knows our CFO, Laura Buchkowski. And she was very supportive of looking outside the box and trying something different. And so that's where the connection came from. So it takes, I think, a combination of your CEO being engaged, your CFO being very, very supportive, and then whoever is overseeing your supply chain from an executive standpoint, helping to have those conversations inside the organization with your peers, so they get to understand what you're trying to accomplish and how you're trying to help them. This isn't about a control change. This is really about a support change. And how do you embed supply chain resources into their departments to help them, rather than removing control of the contracting out? At the end of the day, they are still making the decision. This is just to help them make the best informed decision for the institution, rather than having to try to struggle through that independently. That is what this is about.
I think that's perfectly spoken, is perfectly said. We are a large integrated industry, and there's no such thing as one person on the boat steering it. You have to have a team, you have to have focus. My perspective, I keep smirking at Keith because he's talking about things that I know about, but he's going into details like, wow, he's really good at this stuff. My mentality is I want to make sure that this future of our system, of our health system, is secure, and the direction we're going is the right direction. And I surround myself with people like Keith, and I turn around to people like Keith and say, all right, you got 70% of of our organization that we're not going to likely impact. And that's your labor. That's the things I've talked about. You have 20 or 30% that we might need to look at in a different way, not in a way that says I'm going to reduce this or negatively impact this, but we have to look at it in a different way. So you challenge your team and you say, how can we focus on that? How can we get people in the room to not be critics, but to be idea generators, to not be defensive, to be proactive and look at ways that we can do things differently that actually help us. So you get people that Keith's talking about in a room that I'd walk in and smile and say, thank God you're on our team, quite frankly. But they come back and they say, here's what the challenge you gave us, which is we've got to make sure that we're not in a vulnerable situation. We got to make sure that we're not just thinking about today, we're thinking about tomorrow. And as it drives back to supply chain, it drives back to what I, again, consider traditional silos. And it's not in an aggressive way I'm saying it, or a bad way. I'm just saying it's reality. And we're coming together as a unified team focused on the objective of the organization. You need people in that room to do that, because there's not one person in our industry as big as ours. And again, my background, I had 20,000 people under me. And I was convinced that my responsibility is to take care of 20,000 plus people and to make sure they show up every day and are committed to the vision of this organization. So bringing those people at the table and getting them united about ways to do things, which often require us to be different and to think differently, is necessary. And so I love getting people in the room. I love offering that challenge. And then, Keith, I'm sorry to admit this, I love leaving the room and letting you smart people do that.
Well, I'm right behind you, Brian, so I don't stay very long after. I let the supply chain leaders really lead it. But Dave, it does require kind of shepherding through. And if you think about it, and Brian can relate to this, the increase in wages going on right now in healthcare is breathtaking. And we need a way of trying to offset that expense, because as Brian noted, our margins are not, they are thin, purposefully thin. We reinvest back in the care in the community rather than, taking it as a profit. But when you start to see inflation going up, it is really up to the supply chain and those non-core functions to really kind of focus and say, what can we bring to the table to help reduce the overhead of the organization? And the indirect spend category is a really easy one to kind of work through without any implication at all to the staff and to the patient care. It's really a great place to look if you haven't.
One of the other things that you talked about, it's not always about just driving costs. It's about driving practices and understanding, as you said, rightly, Keith, your stakeholders, your functional leaders control the decision process, but sometimes you don't have full perspective or didn't have full perspective in terms of the cost of those decisions. So when you're making decisions on local versus regional and national vendors, when you're making decisions in terms of diverse suppliers or sustainability. And one of the things that we agreed as we went in this, because to our point, we empower you with data, information, expertise. You make the decisions, but then one of the folks on Keith's team, who was integral to our relationship, asked that we report in our quarterly business reviews. Okay, how many times did we not pick the low-cost supplier because we had another priority, whether it's local, diverse, sustainable, whatever that is, and balancing those priorities because your margins are so thin.
Yeah. No, that's very true. It was interesting. For the folks that are listening to this, I would challenge you to go back and try to benchmark your purchase service spend right now. It is not easy to do. I can tell you what a total joint costs. I can probably tell you what my suture cost is. I can tell you the difference in the vendor's suture cost. But when you start to get into those purchase service categories, it's not an area that there is a lot of visibility into. That is really that initial assessment that you did really gave us perspective that we didn't have. The other thing that was great about that was that we were able to start to see the difference between what healthcare organizations spend for products and what retail organizations spend for products because of the consolidated spend. And so it's going to be great for us to be able to actually use some of your existing relationships to help us lower our costs without even having to change vendors. To me, that's another great like for like transition that should be very, very easy. The data systems, though, Chris, as you know, I really like the reporting structure that you presented. We're going to try to adopt your reporting structure in our other value analysis teams because I think it provides a much different perspective, particularly for our executive team, to understand the decision making that underlies some of these decisions, because it isn't always the lowest cost price or product that we want to buy or service we want to buy. There are other factors that weigh into it. Diversity weighs into it, local weighs into it, sustainability weighs into it, risk mitigation weighs into it. And so how do you provide balance? And I think the data systems that you have and the vendor contracts you have, frankly, provide a nice, a varied approach towards selection of product and a service.
One of the other things that we, as our relationship grows, and we talked a lot about, Keith, about the fact that commercial savings are kind of table stakes, and those are the things that we can help you with in negotiating better rates, better terms, so on and so forth. But also it's the value engineering and the operational redesign and those types of elements that oftentimes within organizations have a little emotion around them, depending on what they might be. And you've talked a bit, about kind of persistent resistors and how we can engage in a productive way there. Do you want to talk a little bit about, kind of navigating that?
Yeah, so change management in any organization, any business, any field, if it involves people, you have to kind of be respectful of the process and really try to work with the individuals. And I say most organizations have early adopters and they have persistent resistors, right? So the early adopters are the ones that know they need help, they want the help, and they know it's not there. The work is a little bit more of a burden to them rather than value to them. And then there are other folks that take a lot of pride in this work and in the contracting and the negotiation. And they might be a little hesitant to move in, to participate. So I really do think establishing the relationships, having conversations, getting them involved with your team or with the purchasing team, including them in the interview process, having them part of the selection, and then kind of going through and doing, a work stream analysis to show them, have you thought about this? Is this an area that we can provide some value? How can we redesign it? Or we've seen it done this way. This might actually make things more automated for you or a little bit more simplified for you. Can we help you in these areas? And not only does that get them engaged and bring them value, but also I think it reduces cycle time. And a reduction in cycle time increases productivity, and more productivity increases value. And so there's a bunch of redesign in the process where you can bring expertise in supply chain from a retail standpoint that we would never see in healthcare, and figure out how to apply that process to a healthcare supply chain team.
As you think about, health systems are growing across the country. There are consolidations of formerly independent hospitals are now a part of groups. Physician groups are part of larger entities, so on and so forth. There's a potential for a lot of efficiency, properly attacked in that area as well, in particular in the non-clinical or purchase services spend. Can you talk, Brian, a little bit about the challenges that come from this consolidation and the opportunities that flow from that?
Well, the opportunities are obvious, which is simply coming together makes you stronger than staying independent. Whether you agree with that or not, that's the logic behind the formation and the mergers. But at the end of the day, it's really, and I don't want to talk very specific about supply chain because, again, as I've told you a million times, you're outside of my scope of expertise. But the concept behind it is exactly what we're talking about, is to figure out a way that coming together makes you more powerful than staying apart. And whether that's formal, informal, whether that's partnering with organizations like yours or becoming officially part of another one, it's the same agenda. It's how do we make sure that we are securing our future? How do we make sure that we're taking care of people, not just patients, people, our staff, our communities, all the things we care about. And I want to jump back for a second. Keith brought up the point about our low margins and the intention, the reasoning behind it. And I want to make sure you understand the importance of that and the categories. Yes, our industry is a low margin industry, and that is because we convert those financials into investments in our community, and that's a responsibility and obligation, which means the lower that number goes, the less we can do those types of things. So we need to figure out ways to, at a minimum, preserve that ratio, at a minimum, so we can continue to invest in the people and the facilities and the technology and to do those things forever. The mergers are really is you have organizations, small and large, that don't have the resources or the scale to be able to achieve what we're talking about. Or that's one of the primary drivers to it. So coming together makes them more powerful. Coming together makes the leverage more legitimate or more influential or more valuable. That is the exact premise behind that. The other thing is, as you come together, you look at what you do well, what others do well, and what you can do better together, which is an exercise that Keith described, which is bring people into a room and talk about what you do, what you need to do, and how to do it together better. So all that wraps around the mergers. I know I've gone from A to Z on that, but at a foundational level, it's the same concept we're talking about, is to create scale, to create leverage, and do what you do better tomorrow than you do today. And that's why these mergers are happening, because some people see it as the requirement to preserve their future. Some people see it as a necessity to stay alive, regardless of what it is. But it's absolutely the same value proposition we're talking about today, maybe on a different scale, but the same absolute agenda.
Keith, I see you taking notes. I causes me to pause and want to ask, okay, so what were your thoughts as Brian?
I'd like to know what the notes are too, actually.
Yeah. So when I was listening to Brian and he was talking about margin, I was reflecting back again to just where we started, right? Which was the amount of money we spend on direct spend and the amount of money we spend on indirect spend, and the opportunities to help to reinforce our bottom line back into our community. And one thing that the folks listening to this may want to do is go back into your supply chains, look at the amount of the dollars you're spending on direct spend and the number of supply chain people working on that spend, and then look at your indirect spend and the number of people working on your indirect spend. And I think you're going to be really, really surprised. And that's where the opportunity is. And so when Dave and Chris came to talk to us, and they did the evaluation, they showed that ratio. And I remember that chart. And most retail is up here, and we were way down here on the investment. And the reality is we were never going to be able to hire enough people to address the spend to the level it needed to, particularly in this job market. And that was one of the tipping factors for us to say it is better to partner in this space because of the expertise and the depth than it is to try to insource it and do it directly. And so I was just reflecting back on some of what you were talking about, Brian, when it came to the bottom line and the margin and the importance of this work.
Yeah. Just to keep going in this conversation, I think it's also interesting because, as Keith mentioned earlier, we are an industry with constant challenges. So what we're dealing with now is how to make sure we continue to do what we do. But remember that our industry's changing, it's evolving. The way we existed 10 years ago or even 5 years ago is drastically different than how we exist today, and going to be drastically different how we exist tomorrow. So add all this stuff together, where we're investing in technology, we're investing in things that we've always invested, but for different reasons. How do we make sure that our EHRs are doing this? Now we're investing in digital platforms like the company I'm running, digital platforms. We're investing in companies that are non-traditional to do things about engagement. Fill in the blanks. It's all over, but our industry is changing. But what's not changing is we need resources enabled to do what we do today and do what we do tomorrow. And that market dynamic is not going to change. We're not going to turn around suddenly and have open up our arms and tons of money rolls in so we can advance our industry. It's not going to happen. We're going to get paid differently. We're going to get paid for different reasons, but the margins aren't going to all of a sudden go through the roof, because that's just not reality. The cost of healthcare for our country is incredibly high. So the political and governmental and fill in the blank categories are not going to sit there and say, let's put another, $100 billion into this today for tomorrow. They might do things in crisis like they're doing now, which is important, but it's not going to be a sustainable model. So people like us have to stand back and say, what are we going to do differently so we evolve and we can do things to make sure that we're successful? All the things we're talking about, but we're dealing with tradition, we're dealing with historic performance, we're dealing with that. So the points that Keith is making and everybody's making is bring in tools, bring in partners like LogicSource that preserve and respect our history and our culture and our team, but bring benefits to us that we can't get alone. I love it. And I don't think it's a debatable position. I think it's a necessity. Whether or not people want to build their own infrastructure and it can achieve the value that LogicSource can bring, maybe that's debatable. Obviously, you know where I stand since I've introduced you to people that I trust and know, and my own organizations. But I think it's an absolute, incredibly well-timed conversation we're having. But it's never going to go away. It's just never going to go away. So I'm giving you guys some caution, because Keith's going to turn to you guys next year and say, great, you saved us X millions. I need you to multiply that by 100 now.
It happens every day.
Yeah.
Brian, I just had that conversation with Chris this week.
Like it's reality. And I'm saying it jokingly, but it is reality that we are operating in such a small, compressed financial world, not in aggregate, but in our spaces, that we don't have the resources to turn around and say, oh, just do this without worrying about X, Y, and Z. We don't have that luxury.
Well, you know what flows from that, Brian, and thank you also. And Keith was mentioning, he and I had an email exchange over the last couple of days, because WellSpan is starting their budgeting process for the next fiscal year. So clearly, our delivery against the promises we've made, against the targets we've set for savings, will influence investments you can make going forward. And and how you set budgets directly impacts where you deploy funds elsewhere if you can reduce a budget in particular areas. So do you want to talk a little bit about the thought process going on right now at WellSpan and in general on budgeting?
Yeah, so Brian brought
I'd love to. Thank you.
Pardon?
Brian's joking. He'd love to talk about our budgeting process. Is what he was I think Brian was teeing it up, though, is that healthcare is in a transition from volume to value, right? So we're moving away from the more you do, the more you get paid, to the better you do, the more you get paid. And there's a demand destruction portion of that as well. So because we cannot continue to sustain the cost escalation that we have in healthcare and expect the community to pay for it. We just can't do it. So we have to do things differently. And the key resource in delivering healthcare are people. And we invest in our people. So if we want to continue to invest in our people, and we have these smaller margins, and our revenue stream may change or go downward in some areas, we have to think about how to maintain that margin in other ways. And that's where efficiencies come in. That's where the supply chain comes in. It's where looking more strategically at your spend rather than as we've done before, which is pretty much, if you're doing more, you can buy more stuff. You can't do that anymore. You have to really make targeted investments in things so that you can continue to provide staff at the patient's bedside or in the community and do what we do best, which is caring for people. And so I think it kind of ties together. And every health system right now is going through the same thing coming out of the pandemic, which was a really hard financial situation for the industry, and trying to redesign itself and reimagine itself. And that's kind of what we're doing here, is we're looking at different ways of doing things outside of the norm to make us better as a health system and as an industry.
And again, it's not going away. What Keith talked about, and most of us lived through early in our careers, if you have a financial crisis, just go get more volume. And that more volume brings more finances and everything's good. That's number one, I don't support that, but that was the world we live in. And number two, it's not going to go back. Now, there are many organizations and states, by the way, it's not gone. So don't misunderstand what I'm saying, but it will evolve more and more and more to value-based care, to care outcomes related to financial indicators. Add to that what Keith's talking about, and you've got nursing shortages going on. You've got wage crisis going on. So it's not going to go anywhere other than more expensive to achieve outcomes. We've got to do. So the budgeting question you asked about WellSpan, the reason I offered to answer the question is because I don't have the answer. And I wanted to exaggerate one so Keith can correct me so I can, no, I'm only kidding. But honestly, it's a challenging environment, and everybody wants to talk, including me, about COVID and all the challenges. And yes, that threw an incredible mountain into this industry and incredible challenges. But when COVID settles down or becomes the norm, which unfortunately it is, that challenge is not going to go away. It's not going to go away. And that's what we've got to get our markets and our industries to appreciate, that, yes, we're going to come through COVID as a strong nation, as a strong health system, as a strong fill in the blanks. But the challenges that it brings forward is not going to go away, meaning you've got to provide resources to your community to affect chronic diseases and fill in the blanks, whatever they might be. And that's not done for free. And it's not going to be done in a way that brings economic resources that are new and enlarging or incredibly big. So we've got to figure out ways to do the things that Keith's talking about. And you guys can be a huge ally in that.
Yeah.
And the other thing I want to ask, Keith mentioned he sent you an email, Chris. Was it 100-time multiple, or was it less than 100-time multiple? What you got there?
Well, we signed a non-disclosure, so I really can't reveal that.
I'm trying to help, Keith.
But I think, look, on that, a couple points you guys have raised. One, I think that on a mission to drive efficiency, don't start by writing a check. So to all of our folks listening, everything we did together with WellSpan, we did on our nickel. So and they own the outcome. So if we couldn't convince them that what we found was real and measurable and attainable, and we couldn't convince them that they needed us to go get it, they owned it, and they could either take it out to market or do it internally. So in an effort to, as a former consultant, please don't hire one and write a big check to get a PowerPoint that says you can save 10%, but you don't have the resources internally to do it. We can build value prototypes in this value assessment that Keith talked about on our nickel and risk that we will prove to you need us to go get it. And there's firms like us, if you don't like us, don't write a check to save money. Was one of the things I just wanted to follow up on. But I think the other part that I wanted to ask you guys about, because I think about my own community, and I won't say where I live because I don't want to offend any system near me. I would be more interested in writing a check to a system that Brian and Keith were involved in, respectfully, because of how they think about efficiency. So when I think about the connection to the foundations for non-for-profit, I think about the same thing. I have some enterprise clients that will remain nameless that I know are doing a really bad job on what is billions of indirect procurement. So they're not managing the shareholders' money. So I think about that if I want to buy that stock. I think about my communities, and if I'm going to write a check and say, look, I want to be a part of helping this community and this health system, I want to know guys like this are running it because they're being efficient with the money that you're. Yeah. So how do you guys think about that? You have inflation hitting you, which means people are going to get hit at home in their wallets, which means foundations are going to be pressured. So how do you think about that in terms of efficiency in the foundations?
I'll answer first. I think it's at the end of the day, I think it's very important, and the philanthropy aspect and the giving aspect is really about what you're talking about, which is making sure that all the micro details we're talking about, and they're not microeconomically, but they're micro at the end of the day. What we exist to do, the reason we wake up every darn morning and we talk about the things we're talking about is because we want to help people. And it is the mission and the vision and the passion of leading healthcare. So in order to your point, and we're expecting a major healthcare donation from you at this point, by the way, Dave, I'm kidding. It is to make sure that why we exist is known and not debatable. That's it. So if you're going to create a culture that ties to the philanthropy and ties to giving, there's no debatable topic. It's you've helped human beings, you've helped people we care about. And ways we need to do that is have the resources to give the services and the care to achieve just that. So there's no disconnection in my mind whatsoever. But at the end of the day, all the topics we're talking about, all the costs we're talking about, all the savings we're talking about exist for one reason, and that's to help people. And all people.
Yeah, David, I agree with you. I mean, I donate to a lot of firms, and they're almost all local. And it's to organizations, one that I know have a need, but secondarily I trust. Are they using the money to the best for the best use of the community? And so I think we have an obligation as a health system to do that. It's really not our money, right? It's the community's money, and we're shepherding it for them. It's our stewardship to them. And so the better that we do that, I think the more people have faith and trust and confidence in us and in individual brand of each health system. They feel comfortable in donating to us, and philanthropy is an important portion of our diversified revenue stream, and it allows us to do a lot of things we wouldn't be able to do without it. So I think you're 100% correct.
Great. Well, Chris, I know we're probably running out of time. Do you have a closing question for our panelists?
Well, no, I mean, as we've been listening to this conversation, and I think there are a couple of themes that came out in terms of and this resonated throughout the discussions we've had earlier, leading up to this point, in terms of serving the greater good, in terms of people like Brian and Keith, willingness to share, opportunities for discussion within, so that other health systems might take advantage of that. I think in terms of, when we work with clients on the enterprise side, on the private side, if we're able to help them be more efficient, they don't necessarily want to share that with their competitors, right? Because that gives them a strategic advantage. One of the things that's come out in the discussions we've had with WellSpan and some others is that willingness and beyond willingness, that wanting to share if I've found something that allows me to deliver better care, because that also will allow other systems potentially to deliver, make the kinds of investments to continue to and build and improve on good patient care. So with that in mind, I would just ask if there were any parting thoughts, Brian, Keith, in terms of, kind of the longer term prospect and how this fits into a better outcome.
Brian, you want me to go first?
Yeah, sure.
Yeah. So, and I'm going to focus on supply chain more than anything else. I've been working with supply chain. I've in healthcare 30 years. I've been working in supply chain with over half of it. I have never been as excited about where this specialty is going as I am right now. And unfortunately, it took a pandemic, I think, to kind of shift a little bit, do some of that shift. But I see so much advancement going on in healthcare supply chain right now, and it really makes me excited because at the end of the day, we're going to bring value to the health system, and that brings value to the community. I think supply chain is actually going to move from being a cost center to a revenue center by saving. That's kind of the goal that we're trying to do right now in WellSpan. And I think it's a great time to spend in the supply chain world.
I'll jump back. I agree 100% with what Keith's saying, and I love how he said it. The competitive markets that we live in are much different today. So the thought of doing it and not promoting it, I don't think are the same as what they used to be. Meaning, if you bring a resource to our industry, people like me and Keith are not going to keep that to ourselves. We're going to be sharing it, and we're going to share because we're not the competitive, hey, we want this group here to only be with us. We want people to have access to good healthcare. We want people to be successful. So if we have a responsibility outside of the organization we work for, it's for our industry, and that's to share resources like you to provide value and to help them succeed in the long term.
Well, thank you. Brian, Keith, this has been a great session. Dave, did you have anything you wanted to add?
No, we should get back to work for WellSpan.
Save Keith saying that? Yes. Okay. Thank you. Thanks so much. This has been terrific, and really appreciate your time today.
Yeah, thank you all.
Thank you, David, Chris, Keith, and Brian, for the fantastic insights. That was a really valuable discussion, and I'm excited for our audience to take what they've learned back to their own organizations. And lastly, I'd like to give another big thank you to LogicSource for their sponsorship of this session. That concludes this portion of the event. Please enjoy the rest of the virtual briefing.